We're on page 6, and we are focused on letter C, Roman numeral 2, right? Okay, so that's what we're doing right now. So let me just say up front, I can't fucking stand late. So all y'all children who walk in late, don't let it happen tomorrow. The door gonna be locked. Okay, let's go, let's go, let's go, let's go. Okay, so what we said was we were doing the first part of the respiratory distress song. And you guys said what?
Pulse ox less than 90.
Okay, pulse ox less than 90. Now let's see who remember. Give me some different ways to write it.
SaO2.
Good. SpO2. I heard SaO2. Oh yeah. O2 sets. What did we say was normal? 95 to 100. And you must act when it's less than 95. We agreed. Yes. And so when we act, if we look at the 10 things we're going to do without you peeking, try to challenge yourself. Let's put the numbers up here. Try to challenge yourself to do it without looking. Start thinking of just anything you remember. Okay, we're going to do some head of the bed. Bronchodilators is good. That's somebody who ain't looking. Good job.
IV fluids.
Okay, IV fluids, CPT. I can write but so fast. Hold
Check
on.
for pain.
Hold on, Sean.
Stay with the patient.
Hold on, Sean. I don't have much to say that. Hold on, children. Okay, so I done forgot all of that because I got early onset Alzheimer's. What the hell did you say? I heard my baby say IV fluids, and then I just heard cough and deep breathe.
Suctioning.
And I just heard suctioning.
Non-breathing mask. Check for pain.
Okay, I heard check for pain.
Stay with the
Increase the
patient.
flow of oxygen.
Okay, we're gonna give them oxygen if they didn't have it and turn it up if they did. Very good.
Chest physical therapy.
And then we gotta put chest physiotherapy, CPT. And then I heard the baby say non-rebreather.
Cough and deep breathe.
We got that.
Stay with the patient.
Stay with the
Stay
patient.
with the patient. Okay, so let's look at what we did. We made sure that we had evidence-based medicine, right? Do everybody got one of these? Everybody got one now? Okay. So we said we had to have evidence-based medicine and that you could not go by ABCs ever again. ABCs used to be the way you and me were taught to prioritize. It used to be what? Airway, breathing, circulation. We talked about how even CPR changed it. They don't do airway, breathing, circulation anymore. What letter series do they do? HAB. They do circulation, airway, breathing. Now, your girl has been teaching 23 years. I've always said that that was wrong. Always. Because the number one issue is behavioral change. They kind of slid it in on you in CPR and you didn't even know it, but they didn't teach it. What that means is that they said it, they did it, but they didn't teach it. So you come out here talking about airway, breathing, circulation. You go take a test with that airway, breathing, circulation. You see all these shortness of breaths and you see them first, and that was not it. And then you're like, well, I did the ABC, but it's like they set you up for failure. So let's think about what CPR taught you to do first. It was not check a pulse. What was it first? Remember I did it in a funny voice? Are you just drunk or dead? Remember that? Actually, that was a poignant moment because if you look in your Oh My God packet, my prioritization for 23 years has been behavioral changes. Annie wasn't okay. That's what you had to figure out first. That's a behavior. The fact that she wasn't okay was the behavior, wasn't it, y'all? And if you look at which one it was, take a look at each of them and tell me what you think it was. Which one of them? Boom! You got this. Okay, so you just know to go at this test with that behavior change. And I literally say this to the babies. I say, if you get question number 74 and it says, which patient needs you to see them first, right? Look for the one that has irritability in the answer. Look for the one that has anxiety in the answer. Look for the one that has apprehension in the answer. Look for restlessness. Look for the patient who walked in with a feeling of doom, apprehension. All of those are see them first. That's how cold they are, okay? So we did good. We did the behavior, but then we wanted to go ahead and do the respiratory song because we wanted to show you how A, B, C. Oh, both y'all late now? So she with you, she made you late. This some bullshit. Okay, I'm going to tell you like this. Tomorrow the door will be locked. I'm sure it's your fault because she was early. Okay, here you go. Don't come in here late. I'm telling you right now. Okay, so when it comes to the next issue of ABCs not working, it's like they do work if you have evidence. This was the most important evidence on your test for you to prioritize outside of behavioral changes. This right here. Now, you did the first part, and with just that first part, just this, you kicked in this immediately. You see what I'm saying? You did it until you couldn't do it no more, or you did it until that came up. That makes sense, doesn't it? In my field, I'm post-op. So my patients' O2 sats drop all the damn time. And all the damn time, I'm putting the head up. All the damn time, we pulling the nasal cannula off the wall and sticking it in your nose. All the damn time, we taking the 2 liters and putting it up to 4. All the damn time, we could go on and on, couldn't we? Okay, so what you're doing as soon as you see this is you kicking in to your 10 nursing interventions. Now, I could put these in a little bit of better order, but we was just shouting them out today. But if you're in the room and you want to do something quick, I like how this was said first. Ain't that right, y'all? Just put the head of the bed up. That's so easy. You ain't got to do shit. I don't need no special mask for that or nothing. So this is the easiest one. But what would you do next if you had to think what's next? Yes, if they're not on O2, stick a nasal cannula in their nose and get them on O2. Now, we got a problem with a nasal cannula. How far can we go with it?
2 liters.
We can only go to what? 6. Excellent. We can only go to 6 liters. If you didn't know that shit, you better write that shit. Okay, so you only could go to 6 liters with the nasal cannula. So right now we did number 1. We slid on up in here on number 7 where it say O2. Y'all good?
So you said it can go up to 6 liters on the nasal cannula. That's not for COPD though. That's for.
It has nothing to do with what they got. It has to do with the tube, the tubing. The tubing only can accommodate 6 liters. So it don't have nothing to do with nobody or nothing. It's got to be that you, when you stick your tube in their nose, yeah, but when you stick that tubing in their nose, the nose itself can't even accommodate that much going on. You feeling me? It's just little prongs. You're gonna burn everything out, okay? Okay, so we just said real quick. We're doing real quick because I got a news flash for you. I told you this shit yesterday. That non-rebreather ain't in your room. You trying to do quick, okay? This is way down the hall in the respiratory closet. Quick, you need to hurry up, Okay, so we being realistic. That's part of the problem with school. They ain't fucking realistic. We being realistic. We walked in the room, this bullshit happening. We going ahead, put the head of the bed up. We done slid some tubing in the nose, put the O2 on. And then what could we do real quick? Cough and deep breathe. That's what I do all day. Honey, I'm gonna need you to take some deep breaths. Give me a couple coughs, baby. All day I do that. This is not just textbook. This is the shit we do all day. What else is real close in your room, in every room? Suction. Okay, so let's do it, y'all. Let's go ahead and put some rhyme and reason to it. Let's do this. Make sure you do it on your sheet. And I do believe if none of that worked, what do you think we really need? Non-rebreather. Yeah, we better get something real, honey. Call respiratory. Now, I notice how I didn't tell y'all to call respiratory therapy. See, what you don't want to do on this test is turf some shit. Turfing shit means that you can't do it yourself, so you done call another brother or sister to do it for you. But you can do this. Make no bones about it. You may work like I do in a big-ass monstrosity hospital and respiratory therapy at your fingertips, and you ain't got to never, ever, long as you live, do a breathing treatment and all other bullshit. Oh, no, that's not how this test is. This test is all about you saving the life. So that's kind of like why you didn't see me put call respiratory therapy. Okay. But in the middle of all of this, if I'm in a real institution, big, crazy, wild, VA, Metro, whatever, I probably would call somebody by now. I mean, obviously, you know. Okay, but you can't do that on the test, y'all. You can't call rapid response on the test. Okay? All right, so we got the 1, the 2, the 3, the 4, the 5. And I don't know, after that, it's like throw it up and let it fall. But what would you maybe think of next? I would have started an IV by now because you're looking like shit. Sound good. If you didn't have an IV, so let's play that back. Let's play the tape back. If you didn't have an IV, I'd be starting one. If you did, I'd be hanging fluids. Does it make sense?
Yes.
Okay. All right, what else?
I do the chest.
I'd like to open their lungs up. You know what I'm saying? Chest physiotherapy is good, but it take a while, right? It's a 15-minute procedure. We can go on and get this in. Okay, so then after that, anything's fair game. Y'all all right with that? Okay, we just got to be realistic because we're trying to save the life, okay? Okay, now we got to move on to the song, baby cakes. What's the next part of the song? PaO2 less than 60. Now, look at this, y'all. Check this out. We said that these two stood for different acts in the human body. When we looked at the pulse ox, we said it stood for what word?
Ventilation.
Ventilation. How would you explain that to a third grader? Breathing. Very nice. Very nice. Okay, so what we said was this whole pulse ox business was all about how do you breathe right now, how you pulling in the O2. And keep in mind, beloved, that this room is, and any other room you in, is 21% O2. A nasal cannula is only going to be about 30% O2. The non-rebreather, 100% O2. Don't that make sense? That's why we kind of like, okay, this motherfucker ain't doing nothing. Let's go get that non-rebreather. The little nasal cannula didn't do nothing. Now we need that non-rebreather. And I told you yesterday, and prayerfully you remembered, that the minute you pull a non-rebreather, now you got to crank it up to 10 to 15 knots. Right? 10 to 15 liters per minute, right? You look crazy putting on a non-rebreather at 6 liters. You look drunk if you put it at 2. So we need it at 10 to 15. If you thought you needed a non-rebreather, the definition of that was respiratory distress. So you got to crank it all the way up, even in the COPD patient, to 10 to 15. Okay, so far so good, right? Okay, so we got our ventilation, and then we had a fancy $4 word for PaO2. Perfusion. when you look at these two, this very related, but very different. One thing that two of these had in common, and I don't know if you noticed it. What did those mean? That lowercase a meant you drew blood. That was arterial blood gases. You don't know nothing about a PaO2 if you didn't draw blood. So now we're getting gases back. You see how this is going? You don't always get gases on these people, do you, baby?